Nail abnormalities often reflect underlying systemic diseases, local trauma, infection, or the dermatological condition. These changes may involve the nail plate, bed, matrix, or the surrounding tissue. Classification of the nail abnormalities, color change. Lycanthia, white nails, types are true lycanthia, nail matrix disorder, apparent lycanthia, subfungal changes, hypoalbuminemia, causes, trauma, systemic disease like hypoalbuminemia and the cirrhosis. Yellow nails. Yellow nail syndrome associated with the lymphedema and the pleural effusion. Fungal infection like onychomycosis, psoriasis. Blue nails causes cyanosis, systemic hypoxemia, Wilson disease, ulcer lunula, drug-induced minocycline. Brown other black nails, subfungal hematoma, melangia, melanocyte proliferation, melanoma, and the racial pigmentation, Addison's disease. Shape and the texture abnormalities are pharyngeal, spoon nails, thin and the concave nails, iron deficiency anemia, hypothyroidism and the congenital clubbing, bulbous swelling of the distal phalanges, loss of the normal nail angle, lung disease, cancer, interstitial lung disease, cyanotic heart disease and the inflammatory bowel disease, pitting, small depression in the nail surface, psoriasis, alopecia areata, eczema, Bewes lines, transverse growths indicating the temporary growth arrest. Severe illness, chemotherapy, trauma, anchorexis, longitudinal raging or the splitting, aging, lithium planus and the hypothyroidism. Onychoschisia, splitting or the layering of the distal nail palate, frequent petting and the drying of nails and the trauma. Growth abnormalities, onchocerciasis, thick and curved nails resembling the ram's horn, trauma, poor hygiene and aging. Terry's nails, white proximal nail with a narrow pink distal band. Life cirrhosis, congestive heart failure and the diabetes. Half and the half nails, Lindsay nails, proximal white and the distal red brown discolorization. Chronic kidney disease. Mees lines, transverse white line, arsenic poisoning, systemic illness. Nail bed and the surrounding tissue like pharyngia. Infection or the inflammation of the nail folder. Bacterial or the fungal infection. Oncholysis, detachment of a nail from the bed. Psoriasis, trauma, fungal infection and hypothyroidism. Splinter hemorrhage, linear red-brown streaks under the nails. Endocarditis, trauma and the vasculitis. Subfungal hematoma, collection of blood under the nail, trauma. Diagnostic approach. Detailed history. Trauma, systemic symptoms, occupational exposure. Physical examination like a nail appearance, surrounding skin, systemic signs. Laboratory tests like CBC anemia, thyroid function, autoimmune markers. Fungal culture for the suspected onychomycosis. Imaging of the biopsy for the suspected malignancy melanoma. Management general measure. Maintain the nail hygiene. Avoid the repeated trauma. Use the gloves for the bedwork. Condition specific treatment like infection. Topical antifungals are terbinafine, efinaconazole for the onychomycosis. Oral antifungals for the extensive fungal infection, antibiotics for the bacterial parenchyma. Psoriasis, topical steroids, vitamin D analog, systemic therapies, methotrexate biologics. Iron deficiency anemia, cholangia, iron supplementation, clubbing. Investigate and manage the underlying systemic cause. Abuse lines address the underlying systemic illness. Procedure, nail avulsion for the severe fungal infection, laser therapy for the onychomycosis or the melanoma, surgical correction for the ingrown nails or the onychographosis. Lycanthia, white nails due to the trauma or the systemic disease. Clubbing, often linked to the heart or the lung disease. Cholangia, spoon-shaped nails seen in the iron deficiency anemia. Bewes lines reflect the temporary nail growth arrest due to the systemic illness. Yellow nail syndrome associated with the lymphedema and the pleural effusion. Splinter hemorrhage indicative of the endocarditis or the vasculitis. Terry's nails and the Lindy's nails associated with the liver and the kidney disease respectively. Oncholysis, nail detachment common in the psoriasis and the fungal infection. Fungal infection, the most common causes of the yellow thickened nails is onychomycosis.